My name is Jessica and I'm going to be presenting on stomach ulcers. First off, what is a stomach ulcer? A stomach ulcer, otherwise known as a peptic ulcer, is an open sore on the lining of your GI tract. The most common ulcers are gastric ulcers that appear on the lining of your stomach. So about 80 to 90% of ulcers are caused by a bacterium known as Helicobacter pylori. H. pylori lives in the mucus layer that lines the stomach and small intestine. When it infects your stomach, it causes redness and soreness that can result in the creation of an ulcer. H. pylori is already known to live in a lot of our stomachs, but it isn't at an infectious rate. And the bacterium is known to make an enzyme known as urease, and its role is to help neutralize the acid in our stomachs. The second main factor is steroidal anti-inflammatory drugs. These are known to increase the risk of stomach ulcers because they are weak acids and they can allow for cellular permeability. With H. pylori being present, it just causes the infection at a much faster rate. Genetic factors have also been recognized to contribute to stomach ulcers in regards to susceptibility of the bacterium infection. Other risk factors include alcohol, smoking, and eating spicy foods. These risk factors are also known to be the cause if an infection is already present. They help aggravate the creation of the ulcer, not so much cause the ulcer. What AI models are available to help assess risk? An endoscopy can be used to help assess the risk and diagnosis of stomach ulcers. They are used to help to confirm the infection of H. pylori with computer-aided images that capture the eradication level of the epithelial lining of one's stomach. So they're able to visually see an infection, which we'll see in an image in a few slides. Demographics. So stomach ulcers can affect anyone. Ulcers of the small intestine are more common in the 30 to 50 age group. Stomach ulcers are common after the 60 to 70 age. This is mainly due because we know with age, our immune system begins to deteriorate. Stomach ulcers are more common in women than men. There have been no findings as to why this is. According to Harvard Health, they affect more than 4 million people in the United States each year. Ulcers are less common in children, but there have been cases of children developing stomach ulcers, and this is usually due to a non-steroid anti-inflammatory drug intake, such as ibuprofen, and they have H. pylori present in their stomach. Anatomy. A stomach ulcer occurs when there is a break in the mucosal layer of your stomach lining. With immune response weakened, eradication can lead to a sore, which ultimately leads to an ulcer. Most ulcers are located in the lesser curvature of the stomach of the duodenum, known as the duodenal ulcer. The duodenal is just before the beginning of your small intestine. As you see, the ulcers are always attached to the lining of the stomach, not the cavity, just the lining. Here are some real life images. The image on the right, we can see where the attack of the bacterium is happening. The one on the left is a much more serious infection that results in a bleeding ulcer. And this is an example of an endoscopy image. Physiology and symptoms. The mucosal layer in our GI tract is there to protect our digestive system, and the mucus begins to get broken down, and imbalance in acid neutralization causes an attack on the lining. When there's an excessive amount of acid in your stomach lining becomes weak, And this is when the H. pylori bacterium begins to create a sore and eventually becomes an ulcer. With the non-steroid anti-inflammatory drugs, the drugs are known to be weak acids and they allow for cellular permeability. So with the bacterium present and the cellular permeability, the infection happens at a much faster rate. And the cells of the mucosal layer begin to get broken down. Symptoms of this include nausea, bloating, stomach pain, intolerance to fatty foods, spicy foods, heartburn, appetite changes, dark blood in stools due to a bleeding ulcer, and vomiting. So physiology. Like I said, the mucus layer in our stomach is there to protect it from our stomach acid, and the Helicobacter pylori can come from contaminated water or food. It is known to live in our stomachs, like I said, some of us, but it is also known to live in well waters or rivers, and we can become infected by direct contact with it. So when the H. pylori infects the stomach lining, it causes an activation of cytokine cells, which are an immune response that causes inflammation. And then the gastric inflammation may lead to the ulcer, and some of them can become severely complicated with bleeding and the symptoms of nausea, vomiting, appetite lead to weight loss. This is when people end up going to the hospital. Diagnosis. Some diagnoses are stool tests used to check for any blood in the stool, and endoscopy allows for visual images to measure any erosion or ulceration and also bleeding status. An X-ray series can also be used with the barium swallow. Barium is a liquid substance that helps to illuminate any ulcers. If you see the image on the right, that is an example of a barium X-ray series. Usually when those are given, also a laxative is prescribed to ensure that your digestive tract is cleared. And blood tests to determine if Helicobacter pylori is present and that there is an infection. Treatment. If the patient is on any non-steroidal anti-inflammatory drugs, the patient is immediately taken off of the medications. And if the patient tested positive for H. pylori, treatment is required with antibiotics such as amoxicillin or tetracycline. They're known to help build resistance to H. pylori. Lifestyle changes are also advised to the patient to reduce risk of another ulcer development, such as no smoking, reducing alcohol intake, and proton pump inhibitors. An example of a proton pump inhibitor is omeprazole. These reduce the acid, which also help to reduce the production of stomach acid. Acid blockers, such as famotidine, can also be prescribed to reduce the amount of stomach acid that is released into your digestive tract, which will ultimately also help relieve any pain of the ulcer. Treatment and AI. Treatment of symptoms is usually completed within days or weeks, but it is known for an actual ulcer to take up to 3 months to fully heal. Treatment has high rates of success. If the ulcer is not healing, this is normally due to patient error and not following treatment regimen. Surgical treatment for an ulcer is rare. Even for a bleeding ulcer, the doctor will use what is known as the therapeutic endoscopy. So to get more into what the endoscopy is, the endoscope is a hollow tube that has a camera lens on the front end of it. Normally, a patient can be put under anesthesia or be given a numbing spray so that they don't feel any discomfort. Since the endoscope is inserted through the mouth, down to your esophagus, into your stomach, and if needed, into your small intestine. That's it. And these are my references. Thank you for watching.